Hi, and welcome to injeb, a 4-week open online course on human reproduction, natural journey towards fertility and reproductive biology with a hint of education about intimacy. Welcome to week 2 of this course. This week is about understanding infertility. At the end of this week, you should be able to define infertility, differentiate between primary and secondary infertility, identify male, female, and combined causes of infertility, recognize the impact of cultural myths and stigma, and explain the basic diagnostic process of infertility. Welcome to this week's second module. Today we explore the female causes of infertility. At the end of this module, you'll be able to identify common female factors of infertility and to explain how age affects fertility in women. To identify potential causes of infertility, we need first to understand the necessary conditions for a pregnancy to happen. So, getting pregnant involves several steps. First, the brain must produce reproductive hormones at efficient levels and at the right time. An egg must mature in the ovary. That ovary must release the mature egg during ovulation, that is, under the command of the brain reproductive hormones, mainly LH, or luteinizing hormone. The fallopian tube must pick up the egg, and the sperm must travel up the vagina, the cervix, and through the uterus to the fallopian tube, where the sperm will meet the egg. The sperm then will fertilize the egg to create an embryo. The embryo travels through the fallopian tube to the uterus where it implants. So, pregnancy can't occur if anything in this process doesn't happen. Regarding female causes of infertility, they are numerous. These causes can coexist within the same patient. They can also coexist with infertility causes within the partner. Some of the most common female causes of infertility are age, ovulatory disorders, tubal damage, and uterine abnormalities. So, female age is a factor of infertility. Fertility naturally decreases after age 35 and especially after 40 years old. The ovarian reserve, that's to say, the number of potential eggs in the ovaries, decline with age. This decline is steeper after the age of 35. Menopause is when women don't have their menses for more than 12 months. Menopause is associated with a natural ovarian failure with no possible ovulation, thus no possible pregnancy. Lifestyle is also a potential cause of infertility. In fact, smoking and using tobacco products plays a role in 15% of infertility cases. Same is for excessive alcohol consumption, substance abuse, having obesity or being overweight, eating disorders including anorexia nervosa and bulimia. Over-exercising can be also negative on fertility, and exposure to environmental toxins such as chemicals, lead, and pesticides can also threaten female fertility. Ovulation disorders are also a potential female cause of infertility. They are the most common causes of infertility in women. Ovulation is the process in which the ovary releases an egg to meet sperm fertilization. Ovulation disorders can be related to several diseases such as polycystic ovary syndrome or PCOS, surgical or congenital absence of the ovaries, primary ovarian insufficiency or poor egg quality, hypothalamic and pituitary gland disorder, which is somehow a brain disorder, genetic or chromosomal disorders, or endometriosis. We're going to go through some examples. The first example we're going to go through is polycystic ovary syndrome or PCOS, which is a reproductive hormonal imbalance that occurs when the ovaries produce excessive high levels of hormones that are called androgens. As a result, women with PCOS often have irregular menstrual cycles, missed periods, and unpredictable ovulation. PCOS can also be associated with signs of high levels of these androgens. It is shown with acne and severe acne and excess of body and face hair. PCOS is one of the most common causes of female infertility, and it can also increase the cardiovascular risk in these women and thus threaten their life expectancy. It is a very serious condition that can be treated and monitored to reduce those risks in women. So these are the ovaries in a patient with PCOS. As you see, all the follicles are at the same level of development, and these androgens are preventing the eggs to mature and to produce enough hormones, estrogens, in order to lead to the peak of LH or luteinizing hormone that will lead to ovulation. The diagnosis is often made on ultrasound. It can also be made through the anamnesis. So, small follicle cysts that are fluid-filled sacs with immature eggs may be visible on the ultrasound due to the lack of ovulation. However, despite the name polycystic, people with PCOS don't have cysts per se in their ovaries to have PCOS. The ovarian cysts aren't dangerous and they are not painful in this case. Another cause of female infertility can be tubal damage. It can be caused by endometriosis, and in this case, endometriosis is defined as the presence of tissue that is similar to the lining of the uterus or endometrium that grows on other parts of the body rather than the lining of the uterus. Endometriosis is a common condition. It happens in 1 in 10 females worldwide. It's often underdiagnosed. It can cause painful symptoms that can impact fertility, but also quality of life. This is a representation of potential locations of endometriosis. When endometriosis grows with within the walls of the uterus, it is called adenomyosis. Uh, Endometriosis can also happen within the cervix. It can happen in the fallopian tubes, leading to the tubal damage. It can also grow within the uterine and ovarian ligaments and on the ovary, leading to endometriomas or endometriosic cysts. Endometriosis can also happen on extragenital pelvic organs such as the peritoneum or the digestive system or even the bladder, with specific signs in this case that are somehow recognizable. For instance, endometriosis in the bladder can lead to bloody urine. Another cause of tubal damage is sexually transmitted infections or STIs. It can also be due to structural abnormalities of the fallopian tubes, either congenital or acquired, or post-surgery, or it can be caused by the pelvic inflammatory disease, which is related to infections of the fallopian tubes or of the adnexa. And finally, tubal damage can be related to prior surgical sterilization, either tubal ligation or salpingectomy. Salpingectomy is the removal of the fallopian tubes, and tubal ligation is just the obstruction without removal of fallopian tubes. Finally, genetic and chromosomal disorder can also be responsible for tubal damage. Another cause of female infertility is uterine abnormalities, and here the main cause are uterine fibroids and polyps. Here we see that the uterine fibromas can or fibroids can be in different shapes or forms and can take place in either the inner layer of the uterus, in the walls of the uterus, or outside the uterus. The fibroids or fibromas that are responsible for infertility tend to happen either within the uterine cavity or within the walls of the uterus. Another cause of uterine abnormalities is prior uterine surgery. In this case, we need to point out that cesarean section, the way of delivering the baby from the uterus through a pelvic incision in the belly of the mother, is an important cause of uterine abnormalities and can lead to infertility, same as any surgery to remove other uterine abnormalities, such as myomal removal. Finally, uterus malformations are also a cause of infertility. So, to recapitulate, age-related fertility decline is a reality that women need to take into account when they are planning to start a family, 35 being the cutoff for the medical definition for infertility, with a lower rate of natural pregnancies after 35 years old. Thus, the shorter period without intervention. The other female causes of infertility can be ovulation disorders, tubal blockage or scarring, uterine abnormalities. Cervical causes can also be there, either through endometrial causes or through fibromas, or even uh, cervical damage, and several causes can coexist within the same patient. Thank you for watching the second module of the second week of injeb, an open online 4-week course on human reproduction, fertility, and intimacy.